Hello, everyone. Om Namah Shivaya, and welcome to another session of Shamil's Talk Show. And we have here with a really special guest over here, and I'm really honored to talk to her because she is a doctor, a really great doctor, and we want to know more about her from herself in further session. So, hi, Pallavi Didi, how are you?
I'm good, Shamil. How are you?
I'm really great. Can you tell something about yourself to the viewers?
My name is Dr. Pallavi Singh, and I'm an eye specialist. I'm currently working in Aims, and I'm just finishing my super specialty, which is in the field of eye cancers and eye plastic surgery, something very specialized. But yeah, so I've been studying for the past 12 years now, and in a month I'm going to finish all of that studying and get out into the real world and just be done with medical school. So yeah,
Great,
doctors don't
that's
really
great.
have. I think they don't have much to say about themselves except for all the studying that they've done. So yeah, that's just about it.
Of course, and I congratulate you and also wish you all the best for completing your whole study after 12 years. That's a really long time.
Thank you so much. Thank you so much.
So, as a doctor, how have you been in these recent days of a doomsday or something because it's a pandemic?
Yeah, so it's been actually quite like a bit of a tumultuous ride for doctors, especially because we kept hearing about the disease that when it started off in China and all of these other countries in January and February, and we know because we've been in the healthcare system for so long, we know how under how much pressure the healthcare system is. So it was sort of a dread that was building up for us way before than it did for the rest of the population, I feel, because we already know that if something of that sort were to come to India, it's going to have a huge impact. So that
Exactly.
happened. Yeah, that happened, and then it started. Of course, once the lockdown happened, we were all posted on COVID duties. So that was very scary to begin with. And in fact, at Aims, I was in the first task force that was posted for COVID duty. So at the end of it, I can say that it went fairly well. But before it had started, it was a scary time because you also didn't know what exactly you were dealing with. The whole world was under the shock, and then to have to go there because it's like a life or death situation because it has affected healthcare workers more than it has the affected the general population. So it was scary, and then after all of that, now we've sort of gotten used to it, and now hospitals are also getting back to normal. We're starting with our normal routine services with our surgeries and all of that. So it's been quite a ride, especially for us, I can say, because from scary to a lot of work and now to finally getting used to the new normal, just for, I mean, like it is for everybody else as well.
Of course, of course. So, you are working in the same hospital where the COVIDs are treated, right?
Yes. Aims has one of the biggest centers of COVID treatment, facilities because, of course, it being a central hospital and a huge hospital, so we've been seeing a lot of patients in all of these months. So yeah.
Are you dealing really close to the patients, or you are a little far?
So now I am not dealing with COVID patients anymore. So we have a COVID task force, and people from each department are posted on the COVID task force. So because I am an ophthalmologist myself, I'm not really in a core branch which like critical care or pulmonary medicine, which would be very essential in COVID care. So we've been posted in wards and we've been posted in screening. So when I was posted for COVID for a month, I was coming in contact with patients then. But apart from that, now I've not been in touch because now we're dealing with our routine patients. But yes, initially in that time that I was posted, I was dealing with COVID positive patients there. Yes.
Goodness, you hats off to your profession, and any kind of thanks is just so little for you. And also, I wanna ask one more thing, that the mental how is the situation of the mental state of the doctors out there working behind you, who are treating the COVID? You must have friend doctors who are treating COVID, right?
Yeah, and not just for people who are essentially treating COVID in the ICUs, but for everyone else, for us also. I mean, it's been it's actually been very, very stressful, especially for doctors, because it's a lot of things. Because one is that you're directly in the situation where for others, you have to stay at home and you have to follow social distancing, but you don't really have to go into the mouth of the tiger,
Exactly.
so to say, right? I mean, we're right there. There's nothing between us and between the disease per se. So it's been very stressful. I mean, for instance, when I was posted for the first time and up until the duty had started, it was a really stressful time because we did not know what we were going to deal with. It was almost like, going to war. Because especially in April, I think everybody, and now we have more of an idea of how the disease spreads, and we have more information. But in April, nobody all across the world knew anything. So
Exactly.
it was just going into the unknown with whatever protection you can go, but you cannot be sure. So I remember, and I consider myself to be a fairly mentally strong person. I don't, I'm not too sensitive.
Mm-hmm.
So, but for me also at that time, it was very stressful, because you don't know if you were to contract the disease, what is going to happen, because young doctors and young nurses all across the world were dying. And it's just a tough situation to go, and you're thinking about your parents. And around that time, I think one of a few instances had happened, where I remember I had come back from my duty at 2 in the night once, and this instance had happened in Chennai, where this neurosurgeon died of COVID because he was treating one of his patients who had COVID. And I mean, once he had passed away, his body was being taken to get buried, and there was a mob of people who had stopped the ambulance and pelted stones, and his co-workers from his hospital had to take his who had to get him buried. He picked him up with his own hands, and one other attendant from the hospital. So that just, and there were other instances of violence. I don't know whether you remember or not, but initially that did happen, that there was resistance or there was backlash when people were trying to do, doctors were trying to do, healthcare workers basically, not just doctors. And to say it is only doctors is wrong, because nurses, doctors, hospital attendants, everyone's been doing their best.
Of
And
course.
when you are subjected to violence, or when your value is not understood, and to be treated like that, that was just heartbreaking. Because you do things, that at some level you do know that you signed up for this. So I don't like to think that we're doing anything heroic, because when you become a doctor, that there are going to be risks attached. But this was an exceptional situation, because over here your own life was at risk when you're treating these patients.
Of course.
And then to see that people are not understanding the kind of stuff you're going through, that was too much. Because, and for me that day, that was a breaking point, because you start questioning everything that you're doing. You start questioning whether it is really worth it. Do you really need to give so much of yourself when people are not I mean, people are going to be treating you this way. And so that was one part of it. But then that passed, that whole fear of treating, or fear of being in that position had passed. But I think apart from that also, it's been very stressful for doctors, especially, I can speak from personal experience, because at Aims we've unfortunately have had a couple of suicides in the past 1 month, and this has been doctors.
I I heard it. I heard one
Yeah,
news. Yeah,
yeah,
absolutely.
it's not just one. It's been a couple. And I think it's just really sad, because when you're going to these wards and you see young patients dying, I mean, it defies all logic. So it can get too much. So definitely, there's a huge mental, there's a stress which is, I think, unimaginable. and not
Of
so
course.
much for myself, because
Of
I
course.
when I was in that situation I was very stressed, but I'm not, I mean, I'm back to being normal now. But people who are still treating COVID patients or being in that situation, because also I think one of the things that has happened is that we've not been able to be in touch with our friends and our families, which has been the
Yeah.
same for everybody.
Hmm.
But on top of that isolation, there is also the additional stress of work and seeing people in a situation where you see that, and I mean, we've seen our colleagues get admitted, and our colleagues deteriorate. Or
Hmm.
if you listen to not just our colleagues over here, but I remember, I mean, listening to all of these stories of a lot of doctors dying in Italy when it had happened.
Yeah, 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 yeah.
Yeah,
I heard.
it's just heartbreaking, you know.
Of course, of course. It's
So
and
yeah.
about and the situation where the people were not understanding about the doctors, what they're being through, or what they are being through right now in this situation. I don't even want to talk about those people who are not understanding, because they are just from another planet. I don't know where they come from, and it was more heartbreaking than the doctors out there, from the people like me, because we were also. I can't even imagine that people could do even these things, to the lifesavers, to the gods, to the second gods over there.
No,
So
but just one thing, Shamil, if I could tell you, one of the things that I had, I mean, I was also thinking at that time that I, I think it's a bit of an overzealous attempt to put us on a pedestal. I don't think doctors or healthcare workers should be looked up to as gods or anything, because we don't do that. We're simply doing our jobs. But the thing is that in return for that, I think you just, what we also expect is to just be treated like humans, you know, because
exactly,
that's what
exactly.
happens when you put someone on a pedestal. It's just easier to sacrifice them. It's like with the armed forces. You sing their praises and you say, oh my God, they're sacrificing so much for the nation, so that it becomes easier to actually sacrifice them for the nation. So I think that perception needs to change, because a lot of doctors also think of themselves as maybe, you know, being greater than what a normal person would be. I don't think that perception is right.
Hmm.
But I
Yeah.
think we should think of ourselves as normal people doing normal jobs, getting the respect or getting the treatment that normal people will. But just that much, you know, not to put us on a pedestal and then throw us down in the gutters and say, if
No,
something wrong happens. So I think instant, rather of the thing, be rather than swinging towards extremes, I think we should just probably, uh, I don't know, aim for a neutral zone where we're just normal like other people.
a great point you have stated, as a doctor, because no one could tell this, except from a doctor, because yeah, everyone is expecting so much from a doctor that if they don't do a thing, they will just go angry or
Yeah,
something.
exactly,
And
exactly.
that's not good. That's because they are doing their job. If they don't do, if they actually tried, and you should actually appreciate them to that they tried to save your life, or they saved your life. And yeah, because they should not be treated as a robot or something, that okay, they will be expecting you to save the life, or you are going to save life 100%.
Yeah.
And if you don't do that, we will not pay you, or will not any other bad thing. So exactly, really, I had a new exposure right now. Exactly, thank you so much, because I'm really honored to talk to you right now. I can't tell you that how much I'm honored to talk to a doctor of
You're
Aims.
being too kind.
No, no, that's completely normal. So yeah, and I have really like variety of questions for you, because you are really see watching the patients from a really close perspective. And yeah, and but I'll short them, and just in a kind of summary, and we'll tell the viewers about you. So and I wanna also ask that you have a vast experience of dealing with many people, or what suggestions would you give to the children to become in the life?
In the sense to become in their lives as a career choice, or I mean, what is it
Yeah,
that you're?
in the career choice.
I think that's it's a very personal this
No,
thing.
yeah, exactly.
Yeah,
Not completely in the career, but yeah, according to the your experience, like what did you like to do while you were becoming a doctor?
I think just one of the things that's important, and especially in the Indian society, that we are not basically told as much, is to be you know have a more holistic development. Because what
Mm-hmm.
happens is that there's a lot of emphasis on your grades in school, and the whole logic of that whole emphasis on grades is that if you study well, you'll get into a good college. If you get into a good college, you'll get a good job. If you get a good job, you'll get whatever certain amount of money, and that is going to give you happiness. But I think what we fail to understand in this whole rat race, or this vicious cycle that we're told to enter, is that the end point of all of these things that we're trying to do is happiness. And so that big picture should always be in our mind, and this should be at all stages of life, whether you're 16-year-old, or whether you're 30, or whether you're 50. I think at all stages you should think about why you're eventually doing these things. Because a lot of times, especially when you're in school or when you're younger, there's just so many influences. There's your parents, there's your peers, and you think, even sometimes when you don't understand, or when you don't realize that, if you're not clear about what you want to do, you just get swayed by what everyone's telling you. So you have to, I think, at the end of the day, enjoy what you do. Just not think of, I mean, if you enjoy what you do, if you like what you're doing, then you will eventually, I mean, you're happy in that moment, right? So you don't need to go through that whole cycle of doing things that you don't like to earn money to be happy, because you're happy if you're doing what you like. uh, and also, I think one very important thing is to know that it's okay to not know exactly what you want. Because I mean, I've been through like the typical you know paths that society carves out for you, of going to medical school and whatever. And it guarantee, I mean, because everyone tells you that, ab 12th kar lo, ab to sab set hai, ab medical college ho gaya, sab set hai. And then you realize that that's going to be, if you want to do well in life, you will have to work at every stage. There's no set hair at any point. There's not like that you work up until you're 25 and then you're good for the next 50 years of your life. So to do well, you have to constantly work. And so I mean, that's the thing. So nothing is final and absolute. And it's okay if you don't know what you want to do at 18. If you're happy with what you're doing at 18, and if you want to change and do something else when you're 25, and then change again when you're 35, it's fine if you're happy in that moment. So I think it's important to realize that there's no rules. Yeah, I think that would be my message, that there are no rules really, because it's your
Exactly.
own life. So there's people who can tell you that this is the way to do things, or that is the right way, and it can guide you and it can give you some insight. Because of course experience matters. To completely negate the experience of people who've been there, who've been doing certain things before you, is also wrong. I think one should take that experience into account, but not be bound by it. Just know that it's one life. You should do whatever you want, and you'll be okay. If you've got your basic, your human traits inside of you, if they're all right, you'll do just fine. So yeah.
Exactly, you are a gem. You are literally telling the truth, because you are a true Dr. Gem, and this is what our Guruji, with my dad, is telling from last 20 years, that the real happiness is not from your materialistic success, which is from money, or which is from just completing everything and going to the job and making your family up, and that's not happiness. If you're doing a 20,000 rupee job, and you are happy with your life, that's good. That you're at least satisfied with your life. and the god will also make you go up. But if you're not happy with a 20 or 30 lakh package or something or more than that, but so it's that's not what we call success, because happiness is the real success. Happiness is the new success, actually. And yeah, young doctors like you, we really appreciate your great vision. You have a great vision, because no one has really stated this point ever in the past in the past sessions. I've asked this many times in to the other people, but yeah, you said it, and I really like appreciate your vision. That's really good. And yeah, I would also recommend all the children also who are watching, or the young, or the like on the go of becoming a doctor, to watch the session, and to have more experience from a true gem doctor like you. So
Thank
yeah,
you.
thank you for being in the session. And yes, one more question I want to ask, that what message you want to give to the people right now living in the homes as a doctor?
I think just what has been already said, and has been, repeated, and you were seeing it all over social media and everything, that we still have to be careful.
Mm-hmm.
And we, I think, just have to get used to the idea of being careful, at least for the next 6 months to 1 year, because until and unless we have an effective vaccine, which is definitively going to get rid of this, we have to be wear masks, wash your hands. These are just basic things. I think some
Physical.
of the reasons why a lot of countries in Eastern Asia, like Taiwan or Vietnam, were able to control the disease, because they've dealt with a lot of pandemics like this before. They've dealt with swine flu, they've dealt with SARS. So the awareness of how to prevent influenza, turning into a pandemic, was a lot higher. So all of them wear masks, and there's hand hygiene, which is, I mean, a lot more common over there than it is in India. So I think it's just a matter of changing habits. And I think we're already there. I mean, most of the people are aware. All
Mm-hmm.
Most of the people are wearing masks, and just practicing hand hygiene, just basic things. So I think but yeah, we need to keep it in our minds that we need to be careful for the next 6 months to 1 year, because especially for young people, we won't see the impact of it so much on ourselves. Even if
Mm-hmm.
we were to get infected, the disease is usually mild, but you don't know who you're spreading it to. You might be spreading it to your debilitated grandparents, or someone who's got other comorbidities. So I think it's important to be careful and to be mindful of the fact that, I mean, you need to do it for everybody. So yeah, just that.
Exactly, exactly. Great. And also, I want to ask a really basic question. Not a basic, but you may know or may not know. But yeah, you're a doctor, and this will be the best time to ask. But I've seen many patients, like many patients right now in the pandemic. I've seen many patients. No, actually, the story starts from I was talking to a friend who is also a doctor, and he was telling that his roommate had positive, was positive, and he just ate a few few normal medicines, and he was, after 7 days, he was cured and he was negative. But some patients are being so serious because of this virus, that they are in the ventilators, or they are in the ICU. So why is that a little difference? Is it because of the mental state, or it depends upon the people?
Uh, I don't know whether there's any evidence to support whether your mental state has anything to do with it, but I think one of the important risk factors is, of course, your age, your comorbidities. If you're a diabetic or a hypertensive, or elderly individuals, are basically going to be more susceptible to the disease. Obese people are going to be more susceptible to the disease. But sometimes, in rare cases, we've also seen perfectly fine young, healthy people getting into bad conditions and being put and being on the ventilators.
Mm-hmm.
But the thing is that we're still in the process of understanding how the virus works and what all systems it's affecting. It affects different people differently, so it has had many manifestations. In most of the cases it's like a normal flu, but sometimes there are people who are coming with strokes, there are people who are coming with lung problems. So I think, again, just to reiterate the basic thing that I was saying, that because this virus has such a huge range of symptoms and such a huge range of how it is attacking the human body, I think it's just best to not take chances. Because some people are like, I'm young, तो मुझे हो भी जाएगा तो कोई फर्क नहीं पड़ता है. But I think you should just be careful, because we've seen young people getting affected, and getting affected in a bad way, being on the ventilator, and even mortalities. So I think it's just best to try not to get the virus, wear your mask and wash your hands. So just that, I
Of
think.
course. Of course, because many a times the diseases are really connected to our mental health, and of course, this is a physical and this is a communicable disease, and it's completely dependent upon the respiratory drops. But yeah, many a times some other diseases are like based upon the emotions. Like young and healthy people are getting used to and getting affected by that disease because they are not they have no lifestyle, or they have not that good or a perfect kind of lifestyle they should have. But yeah, normal people who are weak, or not weak, but yeah, old, but and they're really happy, but they don't get affected by the disease. So yeah, maybe the mental state of a human may affect many a times a human according to the occurrence of a disease. So yeah, maybe let's see
Wait,
what.
something, yeah, it's something one must look into. But I think that's the thing. We're there's in the middle of just so much crisis at this point. But I'm sure there, because there are, like you said, of course, to a certain extent, because your mental state is important. Not, I mean, in many diseases, because your mental state also determines the kind of lifestyle you have. So
Exactly.
if
Exactly.
you're depressed, and if you're overeating, or there's just so many things. There's lifestyle, there's a lot of things. So just the ability to ask for help, or to ask for care if you're isolated, how much of medical help you can be getting. So I mean, of course, mental state in that sense, your mental health is essentially connected to every system of your body, because that is what governs the rest of your body. So, of course, in a way, it is the most important system, one could say. Yeah,
Exactly, exactly. I really like the thing you said, that lifestyle also depends upon how our mental, how our perception is according to what kind of lifestyle we should be. Exactly, that's a great point. I really liked it because I'm studying. I am going to the field of psychology,
right.
into the field of applied psychology. So yeah, I really have much interest in these. So yeah, I'm really attracted by your great vision. That's why I'm really in love and enjoying talking to you.
Thank you so much,
So
Amit.
we are working for the underprivileged children, as you know about our
Yeah.
organizations. So how can you like donate, or how can you help for raising global consciousness, or by helping the children? In what way you could help?
Uh, I think just. I mean, are you asking me as what should people be doing for helping raise the global
Yeah,
consciousness?
what should be people be doing, and also you can what you can do for volunteering.
I think just one of the things that everybody can do, and that is including myself, is do their own job well. If we do that, and if we're working with the best of intentions, I think it's going to this thing. And of course, I think being kind to everyone around you is an important thing. Especially the thing is that in terms of volunteering or helping organizations which are helping the underprivileged, Doctors have an upper hand in the sense because we can directly help with our own skills. We don't need to go through a third party organization. With our own skills we can whether it is surgery or it is checkups. So of course those are the things that we can do. But I think just for everyone else to, in terms of like global consciousness, what you were saying, that if you do what you have to do, if you're doing your and by job I mean not just the job that pays you, but your job in life, your purpose. If you're doing that with full intent, and if you're just being kind to people around you, that's important, because it's easier said than done. uh, it's easy to say that be kind, but there are so many instances where you don't see the other person for what their problems are. And I think, and that's normal for everybody, but I think if we can just uh, keep that in our mind, then maybe sometimes we can correct some of our mistakes, and maybe just take that along our way, learn from that, and do better in the future. I think, yeah.
Exactly. Of course, and I don't need to ask you that you are already helping humanity a lot, and of course, I'm just asking because of the marginalized section, because they need help of all of us. So yeah, I loved talking to you. So
Thank you.
one main question about well, like a really basic question, that what are your hobbies?
Yeah, I know that you were going to ask me that, and I was thinking, I don't know what I'm going to tell him because I just have very like basic stuff, just listening to music, watching stuff on, uh, TV and stuff, and sleeping. A very bad answer, but I love to sleep.
No, not
It's,
a bad answer. Sleeping is a
it's
really
yeah,
great.
very very boring answer. Because I was just thinking of, I mean, and that got me thinking. I was like, I'm not really doing anything interesting in my life, because I was thinking, hobbies is very very basic, just music and reading and sleeping. So that got me thinking that maybe I should probably find new interests and do something interesting.
No
Yeah.
problem, because you already are a doctor. You don't need any kind of interest. You already
Yeah,
have a
that's
brain.
what you do. That's the thing. That's the thing. It this one thing should not define you.
Ah,
Uh, that's I think that's
exactly.
important. I don't
Exactly.
think you just not there shouldn't be any one facet of your life that describes all of you. You should have different facets to yourself, and you should try and work on those continuously, and just,
Exactly, exactly,
yeah,
exactly.
develop
As you
it.
said, as you said that your hobby could be sleeping, but sleeping. You know what? I think this is the best answer I've got any from any other person, because sleeping is a great hobby, because sleeping is something we don't usually make this a really important thing. But yeah, sleeping is a great healing, and
Yeah,
such stressful situations in which you are living, but for the doctors, sleeping is the best thing. I think if you get time, you should already you should really
yeah.
sleep.
That's
Sleep
that's
as
that's
much.
what we do. I think that's what. Or I think if you speak to any doctor, they'll everybody is going to say sleeping is one of the top five activities in their life. Yeah,
Of course, of course. That's great, and that actually should be, because sleeping it's itself is a healing, a really
yeah.
great healing. And yeah, of course, it removes all your stress and all. That's all basic things. So okay, great. So do you meditate?
I don't. I don't.
Okay.
And I think I should, but I don't really. And yeah.
I think you'll not get time also. I think you have
No,
really
I think that's a subjective thing. If you really want to make time for things, you can. I know of
you
doctors who do
yeah,
meditate, but I don't. It's something I should probably, and it's something I've been thinking about. But maybe, yeah, maybe in a couple of years, I'll start doing it, but not right now. No, I'm not meditating
no
right now.
problem, no problem. Because you're sleeping. That itself is a meditation.
Yeah,
That's
probably.
itself.
Yeah, that's my substitute.
That itself, and in psychology we also read sleeping is a kind of meditation. So yeah, because you are in silence, so and being in silence, observing the silence is a meditation.
Yeah,
So yeah, that's great. So thank you so much for being in this session. I really enjoyed talking to you, Pallavi Didi,
it's been my pleasure.
and yeah, and thank you so much for being in this session. And it's been a pleasure having you. And I would really love to talk to you and in the future because you have a really great vision, and I will be having a really great exposure with you.
Thank you so much.
So
Thank you so much for the kind
and
words.
one little thing I just got up my mind that have you heard about Deepak Chopra?
Yes, I have, but I haven't read any of his books. So
Okay, great. Because
thank you for.
he's also passed out of Aims, I think. So you must know, of
Is he?
course.
Is he? I'm not sure. I'm not sure. I'll have to check on that. But
Yeah,
yeah,
he is, and that's why I thought that you must know Deepak Chopra, and yeah, and he wrote about our organization, and yeah, he wrote about Guruji.
right.
So yeah, and we spoke about Guruji, and yeah, he really um, did many things about our organization. So I thought you must know Deepak Chopra. So okay, thank you so much, Pallavi Didi, for being in this session, and
Thank you so much, Amal.
again, yeah, and we'll look forward to join the session again in the future because we are this is not the only talk we are gonna end. We maybe if you get time, we'll have another session and bring more and more experience to you from you to the people. So
I would
thank you
love to
so
do that. Thank you so
exactly,
much.
exactly. Thank you so much for being in this session and Om Namah Shivaya.
Om Namah Shivaya, Shamal.